Welcome everyone. I'm just going to give a few seconds at the beginning so that everyone can join. I know it takes a few seconds to start up for a few people. Okay, well, hoping that everyone's managed to join us. Good afternoon and good evening, potentially good morning, depending on where you are. Thank you so much for joining us, and a very warm welcome from Medical Aid for Palestinians, from Al-Haq, and from the Jerusalem Legal Aid and Human Rights Centre to this webinar on the topic of COVID-19 and the systematic neglect of Palestinians in East Jerusalem. My name is Rohan Tolbert. I'm the Advocacy and Campaigns Manager at Medical Aid for Palestinians. For those of you who might be new to MAP and our work, we are a development and health organisation. We work in the Palestinian refugee camps in Lebanon, we work in Gaza, and of course we work in the West Bank, including East Jerusalem, the topic of today's conversation. Our model is working very much with local partners to provide access to essential health services and to support the development of a future where all Palestinians can access an effective, sustainable and locally led system of healthcare and the full realisation of their rights to health and to dignity. Much of our recent work, of course, has been very much focused on emergency response to the COVID-19 pandemic, through which we've been prioritising infection prevention, and containment of the disease, providing hygiene kits to families in quarantine, providing personal protective equipment or PPE for health workers, COVID-19 testing kits and disinfectants to help prevent the further spread of the disease. If you're interested in that information, there's plenty more on our website, map.org.uk, where you can also find information about our other ongoing programs. But of course, as an organisation, we recognise that many of the real barriers to the vision that we seek are political, they're social, and they're economic. And that's why we have a small advocacy team, of which I'm one quarter, that works to raise awareness of some of those issues and to enable and mobilise local and international action in order to try and address them. So before we get on with our panel, I just want to do a small amount of housekeeping. We are hopefully live right now on Facebook. And we've also turned off audience videos. This is to protect people's privacy and also because we're recording the event, and we hope to be able to share it afterwards if you miss anything. Our panelists, are going to speak hopefully for the first 30-35 minutes, which will hopefully leave us enough time at the end of the session for questions and answers. You should be able to see at the bottom of your screen a small Q&A box. If you've got any questions throughout, please click on that and ask your questions in there. If you want to ask specifically for one of the panelists, then please put their name in there. And also please, if you wouldn't mind, put your name and your affiliation if you're comfortable doing so, because I think the questions themselves are going to be anonymous in that box. There is also, I recognise never quite enough time for all the discussions at these events. So we will be sharing in the chat bar at the side links, updates, little bits of information that you can go away from this event and maybe learn a little bit more about some of the things that we're talking about. And finally, with the chat, it should be open as well. And if you want to join in the discussion, then please do so. I know that a few people are still joining, so I'm still just doing the housekeeping at the moment. If you want to get involved in the discussion, please do so on the sidebar. We ask, of course, that you be fairly respectful whilst doing so. So our aim this evening, and welcome to, I can see people still joining, and welcome to those who are just joining now. Our aim is to discuss the main themes of a briefing paper that was recently launched this month by Medical Aid for Palestinians, by Al-Haq and the Jerusalem Legal Aid and Human Rights Centre, JLAC. And for these three organisations to also share their perspectives on the issues raised in that briefing paper. Clearly, the pandemic itself, globally, not just in Palestine, has really exposed inequalities, exacerbated situations of discrimination and injustices, and the long-standing denial of social determinants of health, such as adequate food, housing, and sanitation. This paper specifically explores the situation in East Jerusalem before the COVID-19 pandemic, including the impact of prolonged occupation, of illegal annexation, and the structural discrimination against Palestinian residents of the city. And it looks at how these issues have undermined the health and access to healthcare for Palestinians in the context of the current pandemic. So the relevance of this discussion is really twofold. Firstly, the pandemic is ongoing, of course, and it's moving to a chronic phase. We recognise at Medical Aid for Palestinians, sadly, that we're going to be responding to it probably for many months to come. Yesterday, in the last 24 hours, 250 new cases were recorded in East Jerusalem alone. The whole of the West Bank is really experiencing a surge in COVID-19 cases. But East Jerusalem currently, over the last 24 hours, has seen the single highest increase in cases. So that brings the total number of cases diagnosed in Palestine to 11,000. And there are clearly needs to learn lessons from the first phase of the pandemic and encourage and mobilize action to protect residents of East Jerusalem and, of course, the rest of the occupied Palestinian territory during the continuing pandemic. And the second reason for the event, and the reason that this is so apposite at the moment, is, of course, the Israeli government's threat of further formal annexation in the West Bank. The experience of Palestinians living in East Jerusalem probably holds some warnings for what may await other Palestinians in the West Bank if Israel is to formally entrench its discriminatory control by extending its sovereignty illegally to further areas of the West Bank. So if you haven't had a chance to look at the briefing paper itself yet, I really recommend doing so. We'll share a link in the chat. It's available as well at map.org.uk/EJ-COVID. And also on that page, we have a copy of it in Arabic, and we also have a 2-page summary focused on the UK context and UK policymakers making recommendations for the UK's foreign and aid policies. So onto the panelists themselves. We're really fortunate this evening to be joined by three of the principal authors of that briefing paper, and each one of them, of course, a real true expert in the issues that we're discussing. We're first going to hear from my colleague in the West Bank, Asil Baidoun, who is MAP's Advocacy and Communications Officer. She's going to give us some insights into how Israel's planning, zoning, permit regimes and other policies affect the lives of Palestinian Jerusalemites, including herself. And she will briefly outline some of the ways that these have undermined communities' ability to respond to the pandemic. We're then going to hear from Rania Mahareb, who is the legal researcher and advocacy officer at Al-Haq, who's going to outline some of the relevant international legal framework for the issues we're discussing, and in particular Israel's obligations as pertain to health and healthcare in East Jerusalem. And then finally, and certainly not least, we're going to hear from Budur Hassan, who is the legal researcher at JLAC, the Jerusalem Legal Aid and Human Rights Center, who's going to place the report into the wider context of annexation and draw links to the wider policies affecting Palestinians in the rest of the West Bank and beyond. So that's plenty from me, and let me hand over straight away to Asil Baidoun, who is MAP's Advocacy and Communications Officer. You're very welcome, Asil.
Thank you, Rohan. We're pleased to know that you're interested in the issue of the right to health in East Jerusalem, and we highly appreciate your presence today. Again, I'm Asil Baidoun, the Advocacy and Communications Officer at MAP in the West Bank. So in East Jerusalem, we have around 370,000 Palestinians residing there at the moment, including myself, and we account for some 40% of the city's population. We are required to pay taxes to the Israeli occupied authorities, but do not receive the same municipal services as Israeli Jews, including settlers illegally residing in occupied East Jerusalem. Palestinians in East Jerusalem face discriminatory planning and zoning, and are only allowed to build on 13% of the land in East Jerusalem, much of which is already built up, and only 7% of housing permits in the city are granted to Palestinians. In 2003, Israeli occupying authorities began construction of the wall in the West Bank, including in and around East Jerusalem. The wall and its associated permit and closure regime, including severe movement and access restrictions, has completely sealed off Palestinians in the city of Jerusalem from the rest of the West Bank, entrenching the isolation of Jerusalem and the fragmentation of the Palestinian people. About a third of Palestinian residents live in Jerusalem neighborhoods behind the wall, which include Kufr Aqab to the north, Shafat refugee camp, and Anata to the northeast. Israeli checkpoints physically separate them from the rest of the city. Over the years, Israel's Jerusalem municipality and various Israeli government representatives have deliberately neglected these neighborhoods and effectively absolving them of responsibility towards upholding the rights of about a third of East Jerusalem's Palestinian residents. Consequently, these areas have essentially become a no man's land. However, Israeli military raids, arrest operations, as well as house demolitions continue in these areas. For example, I live in the area of Kufr Aqab, and in 1967, the population was about 10,000 residents. Imagine now, the population has risen to estimated more than 60,000 residents. Yet, alongside this population explosion, the lands of the village are continually diminishing due to Israeli confiscation. And believe me, no one is a big fan in living in Kufr Aqab, but we have no other option as East Jerusalemites, and here is why. Due to the lack of building permits, Palestinians are rarely given a permit to build a new house or expand their old one, which left the prices in East Jerusalem unimaginable due to the limited options and the very high demand. So for someone like me, affording to rent or buy a house in Jerusalem is like almost impossible. However, also, East Jerusalemites are unable to live outside the municipality borders, as Palestinian residency rights can be arbitrarily withdrawn by the Israeli occupation. For example, should Palestinians leave Jerusalem to study or work abroad, or even move elsewhere in the occupied West Bank? No option for that, as Israel has revoked the permanent residency rights of over 14,500 Palestinians under such circumstances since 1967. Now, imagine as a Palestinian from East Jerusalem, you fall in love with another Palestinian in Ramallah, which is a city 15 kilometers away. He can't reach Jerusalem as Palestinians from West Banks are not allowed to enter Israel unless issued a permit, which is a rare case. And I, as a Palestinian from Jerusalem, cannot live anywhere outside Jerusalem, or I will lose my residency, keeping me not only stateless, but with no rights or legal status to reside anywhere. How much complicated our lives can be. At the same time, Palestinian residents are required to submit requests for family unification for spouses who are not residents of East Jerusalem, a very lengthy, cumbersome, and complicated process that largely denies Palestinians equality in the right to family, life, and marriage. And the best case scenario for my spouse was to receive a permit for 1 week with no staying overnight every 3 months. Imagine, 1 week every 3 months. Now, talking about the pandemic, COVID-19 has shown how the systematic neglect and the development of Palestinian communities and healthcare have resulted in a lack of testing facilities, inaccurate and unreliable data on COVID-19 transmission, harassment, arrests, and persecution of Palestinian health volunteers, and the ill-preparedness of Palestinian hospitals to meet the needs of the population due to the policies of the development of Palestinian healthcare. These are further evidence of Israel's continuing violation against Palestinians' right and health and the social and economic determinants of health, such as adequate housing, water, sanitation, work, and education, and its chronic failure to meet its duties to the occupied population of East Jerusalem under international humanitarian law and international human rights law. According to estimates by the Jerusalem Alliance to confront the coronavirus pandemic, the hardest hit communities by the coronavirus have been the Palestinian neighborhoods of Silwan, Shafat refugee camp, Kufr Aqab, and Isawiyah. Palestinian residents of these neighborhoods already faced extreme housing shortages and overcrowding before the pandemic due to Israel's refusal to grant them building permits, making social distancing and self-isolation virtually impossible. As far as Palestinian communities beyond the wall are concerned, the first testing centers opened as late as 13th of April, nearly 2 months after the first confirmed cases, and only following a petition to the Israeli High Court of Justice by the Palestinian human rights group Adala. So in addition to delays in the provision of quarantine facilities, arrests, and the persecution of local volunteers distributing aid materials and foodstuffs, closure of community-led initiatives to contain COVID-19 and raise awareness as to the pandemic, and the initial failure even to provide data on the numbers and rate of infections in Palestinian communities, as well as to issue information and guidance for the Arabic public, for the Arabic-speaking public. On a similar note, as a Jerusalemite, I received care in a center in East Jerusalem, and most of its medical staff are also Palestinians from the city. However, all the data, test results, instructions are in Hebrew, a language that I don't speak. Remember my story with my spouse in Ramallah? So now I'm pregnant, but my pregnancy booklet is all in Hebrew. All the information, dates of checkups, results, instructions, and tests are in a language that I don't understand. And when I asked for an English or an Arabic alternative, it does not exist. Imagine your personal medical record is in a language that you don't speak. Even my language makes up 40% of the city's population. The case of East Jerusalem demonstrates how Israel has, through formal annexation over areas of occupied territory, entrenched its structural discrimination, systematic neglect, and the development of Palestinian communities and institutions, including healthcare. This situation has been preserved by inaction by the international community, which, though holding steadfast in refusing to recognize Israel's sovereignty in East Jerusalem, has failed to end Israel's pervasive violation of Palestinians' fundamental human rights in the city.
Thank you so much for that, Asil. And also, I mean, probably most importantly for grounding this discussion in the real experiences of Palestinian Jerusalemites. It's really important, I think, to remember that the issues we discuss here often seem like political abstracts, but really there is a daily grinding reality for Palestinians living under this discriminatory system of control and its impact, of course, on healthcare. Before we move on to our next speaker, I just want to remind everyone, and especially those who joined us a little bit late, if you've got any questions for the panelists for our Q&A at the end, please use the Q&A function, should be at the bottom of your screen, and we'll collate questions towards the end. Thank you so much. And now over to Rania Maharib, who is the legal researcher and advocacy officer at Al-Haq. Over to you, Rania.
Thanks so much, Rohan. And thanks also to the team at MAP for organizing this webinar. I'd also like to thank Asil and Budur for all the great work that went into the joint briefing paper, as well, of course, as the teams at Al-Haq and JLAC for making this possible. So to start off, I'm going to be talking about the right to health in relation to the COVID-19 pandemic in Jerusalem. But to start off, I think it's important that we remember that around the world, the COVID-19 pandemic has really brought to the forefront cases and exposed structural weakness in states' responses, not only to the pandemic, but also in general, their longstanding failures to fulfill fundamental rights, in particular economic, social, and cultural rights. And this is something that we look at in the joint briefing paper. And we also highlight that the pandemic has exacerbated, not only in Palestine, but elsewhere, situations of discrimination, injustice, and underlying rights abuses worldwide, including for the Palestinian people. This has been particularly the case in Jerusalem, where the Israeli occupation meets illegal annexation, as I think my colleague Budur will explain later on, structural discrimination targeting the Palestinian people, as well as decades of institutionalized neglect and the development of Palestinian healthcare. We know, for example, that Palestinians in Jerusalem, as elsewhere, have suffered prolonged displacement and dispossession since the Nakba, or the catastrophe of 1948. This is coupled with the prolonged denial of Palestinian rights, including to national self-determination, as well as the right of return of Palestinian refugees to their homes, lands, and property. In Jerusalem, Palestinian dispossession is institutionalized through a precarious residency regime, as we've just heard, which requires Palestinians to continuously prove that their so-called center of life is in Jerusalem. Should the status be revoked, they will also lose access to social benefits, including access to healthcare. For this, they would need to prove an onerous requirement that is the center of life policy imposed on Palestinians in the city. And of course, as we've just heard from Asil, Palestinians also face discriminatory planning and zoning, which drives their transfer from the city of Jerusalem. In 2019, for example, Al-Haq documented the displacement of 236 Palestinians as a result of house demolitions in the city of Jerusalem, including 122 children displaced as a result. In addition, we know that the Israeli Jerusalem municipality deliberately avoids significantly investing in Jerusalem neighborhoods, Palestinian neighborhoods in Jerusalem, including investing in infrastructure and services. And we know that about 72% of Palestinians in the city of Jerusalem live below the poverty line. This is the context that we were talking about before the pandemic even. So this is the scene in which the pandemic takes place in Jerusalem. As well, and as you mentioned, the question of the wall which separates Jerusalem from the rest of the West Bank. Of course, this means that it has severely impacted Palestinian access to Jerusalem, including to hospitals in East Jerusalem. And that's despite the fact that East Jerusalem's 6 non-governmental hospitals are the main providers for routine, emergency, secondary, and tertiary care for Palestinians from the West Bank and Gaza. Patients and staff require a permit to access Jerusalem from the Israeli occupying authorities. At the same time, the process of obtaining a permit is extremely complicated and difficult and is stressful and confusing for both the patients and their family members. With this context in mind, we need to also remember that Israel has strategically fragmented the Palestinian people into separate legal, political, and geographic domains. Together with the de-development of Palestinian healthcare, including in Jerusalem, this has created extreme vulnerability for Palestinians. This means, of course, that Palestinians have become ill-equipped to deal with any sort of public health crisis, let alone the outbreak of a pandemic such as COVID-19. Over the years, we've seen this de-development of Palestinian healthcare exacerbated by chronic underfunding of East Jerusalem hospitals, which is the setting as well of the COVID-19 crisis. And this impacts naturally the delivery of medical care and treatment, not only in Jerusalem, but in the rest of the occupied Palestinian territory. There are acute shortages of ICU beds, ventilators, and personal protective equipment in Palestinian hospitals, which have further undermined the ability of these hospitals to respond to COVID-19. Amongst the Palestinian-run hospitals in the city of Jerusalem, Al-Maqasid, Augusta Victoria Hospital, and St. Joseph Hospital are the 3 that were designated to manage COVID-19 cases. Yet between them, they have 6 beds and 22 ventilators for COVID-19 patients. And of these, about 12 ventilators are already reserved for patients at Augusta Victoria Hospital with extremely compromised immune. As we explain in our briefing paper, the pandemic hit at a time when all of these hospitals were already facing exceptionally dire economic conditions. Al-Maqasid, which is the largest Palestinian hospital in Jerusalem, has been struggling for its very survival for the last 2 years. Both Al-Maqasid and St. Joseph Hospital received additional funding from the Israeli Health Ministry since the outbreak of the pandemic. Yet the funds that they received do not come close to covering the needs of about 370,000 Palestinians in Jerusalem. And this is, of course, without considering that Palestinians in the West Bank and Gaza further rely on access to East Jerusalem hospitals for medical treatment. It's important here, I think, to note as well that it is the right of the occupied Palestinian people to develop a functioning healthcare system and to provide and receive the treatment they need in Palestinian hospitals. The fact is that the availability of Israeli hospitals for Palestinians in Jerusalem does not absolve the Israeli occupation from responsibility for the deliberate weakening, de-development, and systematic neglect of Palestinian hospitals in East Jerusalem. Turning now to the legal analysis, we know that under international humanitarian law, Israel must provide the essential supplies needed by Palestinians in occupied East Jerusalem, as well as the rest of the occupied Palestinian territory. For example, under Article 56 of the Fourth Geneva Convention, Israel, as the occupying power, must adopt the necessary prophylactic measures to combat the spread of epidemics, including to educate the general public, distribute medicines, organize medical examinations and disinfection, establish stocks of medical supplies, dispatch medical teams to areas of outbreaks, as well as open new hospitals and medical centers should this be required. At any rate, the Israeli occupying authorities may not hamper the provision of essential supplies and foodstuffs, as we have seen in its response to the COVID-19 outbreak in Jerusalem, nor nor can they undermine the delivery of awareness-raising materials to Palestinians. Rather than arresting volunteers, as we have seen since the start of the pandemic, and shutting down a center to test COVID-19 initially in Silwan, it is incumbent upon the Israeli authorities to set up clinics and testing centers for Palestinians throughout the occupied Palestinian territory. Under international human rights law, and Nasil has touched upon this a bit, Israel has an obligation to respect, protect, and fulfill the right of Palestinians to the highest attainable standard of physical and mental health. This includes an obligation to maintain a functioning healthcare system in East Jerusalem and the rest of the occupied Palestinian territory, as well as to provide essential medicines and supplies and access to healthcare for Palestinians in the West Bank and Gaza. This means that Israel has an obligation to strengthen the functioning and development of Palestinian hospitals to ensure that these hospitals are actually adequately able to respond with the necessary resources and equipment to COVID-19. Critically, we know that fulfillment of the right to health requires enjoyment of the underlying determinants of health and well-being, such as the right to adequate housing, water, sanitation, and food, the right to work and education, the right of access to information, and the right to a life of dignity. Yet Israel's discriminatory policies continue to deny Palestinians in Jerusalem their right to the enjoyment of these underlying determinants of health, including adequate housing, which results in overcrowding in the city, illegal house demolitions, and of course the acceleration of Palestinian transfer and erasure from Jerusalem. The World Health Organization recognizes that the underlying conditions of life needed for the enjoyment of good health and well-being by Palestinians are detrimentally affected by the situation of ongoing military occupation. WHO also considers that the conditions in which people live and work can help to create or destroy their health, with health inequities constituting the unjust systematic differences in health outcomes among different populations that result from the political, economic, and social conditions in which people are born, grow, live, work, and age. Overall, beyond the grave health consequences that we've seen as a result of COVID-19, the ramifications of the pandemic threaten to intensify and exacerbate long-standing and structural discrimination against Palestinians. Any recommendations in this regard need to take into account not just the direct health challenges created and caused by COVID-19, but the general context of Israel's prolonged occupation and widespread and systematic human rights violations against the Palestinian people. Israel has shown over the years a persistent failure to uphold the right to health of Palestinians. As such, in our joint briefing paper, we recommend that third states support the Palestinian healthcare system in Jerusalem, as well as the Palestinian healthcare system in general, and Palestinian hospitals in the city of Jerusalem. And we called on states to ensure access to East Jerusalem hospitals for all patients from the occupied Palestinian territory. And this was a recommendation last year from the UN Commission of Inquiry on the Great Return March demonstrations in Gaza. We also urged that third states put pressure on Israel as the occupying power to end policies of systematic neglect, which disproportionately impact Palestinian health outcomes, as well as all forms of illegal collective punishment, as recently recommended by the UN Special Rapporteur on Palestine. This comprises policies driving Palestinian displacement from Jerusalem, such as residency revocation, as well as closures and movement and access restrictions impacting access to healthcare. In addition, we called on third states to promote the enjoyment by Palestinians of the underlying determinants of health. We highlighted in this regard the urgent need to address the root causes of Palestinian oppression through the realization of the inalienable rights of the Palestinian people, including, of course, self-determination, as well as the right of return to their homes, lands, and property. Ultimately, we stress the need for genuine accountability, including through international legal avenues, in order to prevent future violations, provide justice to Palestinian victims, and end Israeli impunity. Thank you.
Thank you so much for that, Rania. A really comprehensive overview of some really important issues. And a reminder as well, of course, that lying behind the health and healthcare issues facing Palestinians in East Jerusalem and beyond are breaches of solemn duties under international law, and their violations that the international community, including the UK, have to play a role in addressing. Impunity really is an underlying threat to health, and there are no humanitarian-only solutions to what are effectively really severe humanitarian problems facing the Palestinians as a result of those violations. Just another reminder to everyone, again, please do be using the Q&A function if you want to be asking questions for the panel towards the end. And it's now time to hand the floor over to Budur Hassan, who is the legal researcher at the Jerusalem Legal Aid and Human Rights Center, JLAC. The floor is yours, Budur.
Thanks, Rohan. Thank you to MAP for organizing this event. Many thanks to Rania and Asil for their comprehensive presentations. Now, we obviously, all of us remember that we approached July with one issue on our minds, which was the perhaps start of formal annexation. Perhaps it's a testament to the fluidity of attention or political affairs, or perhaps it's just a testament to how quickly things change, that within the framework or within the space of just 2 weeks, the attention here has quickly shifted from the talk of formal annexation of areas of the West Bank, particularly Area C, into the new or second wave of the pandemic that is hitting Jerusalem and the West Bank and the rest of areas controlled by or occupied by Israel very hard. But that should not make us forget that what Israel is subjecting Palestinians to, whether annexation takes or when, because it's more a question of when rather than if this will happen and how this will happen. And Jerusalem gives us a quite clear picture of what annexation can look like when it's formally upheld after it has been for decades implemented on the ground. So first of all, I will just try to talk about what kind of political reality we find ourselves in as Palestinians, not just those of us living in Jerusalem, but Palestinians throughout historic Palestine, be it within the Green Line, within the areas occupied by Israel in 1948, or in Jerusalem, or in the West Bank, and also in the besieged Gaza Strip. It's first of all important to, and also Palestinians in diaspora. It's first of all important to say that despite Israel's policies of fragmentation for more than 7 decades of the Palestinian people, that the type of oppression, and this was clear and actually highlighted by the coronavirus pandemic, despite Israel's use of a hierarchy of oppression and implementing or manifesting different forms of oppression against different Palestinian people concerning where we are based, that the reality of oppression faces us is unified, and it's one, whether we exist or whether we live in Jerusalem, whether we live in Haifa, in Nazareth, in Ramallah, or in the Gaza Strip, or in the diaspora. We face the systematic injustices and structural discrimination that both Asil and Rania touched upon. And why I say that this has been exemplified by the corona pandemic, because for example, one of the things that faced Palestinians, both be it in Jerusalem, which is an area occupied by Israel in 1967, or in Nazareth, which is an area occupied by Israel in 1948, both of these territories have suffered from neglect, from medical neglect, from lack of sufficient testing. Both of these areas suffered from Israel's use of intelligence in order to track, under the guise of confronting coronavirus. The JLAC, the Israeli intelligence, has granted itself unprecedented powers, which has been implemented obviously against Palestinian people before, but has been escalated since the outbreak of the pandemic. So the Israeli intelligence has given itself unprecedented powers to track residents and Palestinians, and even subject some Israeli citizens to that power, which they have suddenly discovered that Palestinians have been suffering this for a long time. Another example of what it means to live as a Palestinian under the threat of the pandemic is Israel's consistent use of the counter-terrorism discourse as a way to fighting the pandemic. Of course, this is not exclusive to Israel. We've been seeing that many Palestinian or many governments all over the world are using this counter-insurgency and counter-terrorism and warmongering discourse to face the pandemic instead of using a health health-oriented discourse. But in Israel, this discourse takes on a particularly crude form, because when Israel talks about fighting this pandemic as if it fights a war, we all know what this means. When Israel employs its national security services system to fight the pandemic instead of dedicated or professional health experts, we know what the implications this means for Palestinians, what kind of tone this means for Palestinians. When Israel sends its police in order to enforce for health-related issues like wearing of masks, when it sends its police to enforce these realities upon Palestinians, we again all know what it means for Palestinians to have Israeli police, again, under the guise of enforcing health-related regulations, storming offices or stopping and frisking people to make sure that they're wearing the mask without even the police wearing masks. So all of these are examples of how a pandemic or how a health-related issue has been manipulated and has been exploited by Israel's government in order to entrench its counterinsurgency discourse, particularly against Palestinians, and in order to strengthen this rhetoric of violence and war and use it in this specific circumstances. The second condition, or the second part of the reality that we're facing, is the formation of Israel's new government. Again, under the guise of fighting the pandemic, both sides, supposedly opposing sides of the Israeli political spectrum, which are not really both sides, because both, in a sense, are alienated or are parts of a right wing, but such is the reality of Israel that a militaristic former defenseman and former general in the army is considered relatively center, even though he's exactly right-wing. Just it gives you an extent to know the extent to which Israeli society has geared or has been gearing towards the right for such a long time. So this has been an opportunity for finally an end to the political impasse in Israeli politics and the formation of the new government, which again took place under the guise of fighting the corona pandemic in April. But since then, obviously, the main issue that these two, Gantz and Benjamin Netanyahu, agreed upon was to start with the formal annexation of territories of the West Bank. Under pressure, under political pressure by the European Union and partly also by the United States, because it didn't want a non-compromised solution, Israel agreed to freeze, supposedly, without obviously declaring it. There was no declaration, because all of us were expecting that this would start in July, that they declared that the beginning of formal annexation would start in July, and many of us were wondering what it will look like and how it will look like. We didn't really ask if it will happen, because we were sure it would happen. But supposedly under certain amount of pressure, Israel delayed its implementation of formal annexation. Now we shouldn't be celebrating this delay. This delay didn't happen because there was an opposition within the Israeli political spectrum to this implementation of annexation. Obviously, there was opposition, but not to annexation, not to formal annexation itself, but to the repercussions that this annexation might impose on Israel. There was opposition to what this make Israel looks like, because many of Israel's allies who consistently support the colonial endeavor that Israel has been leading against the Palestinian people are not really concerned with whether Israel will extend its sovereignty illegally to more Palestinian land. They're more concerned of how this will look like in the eyes of the world. So in order to maintain this this aesthetic pretense of Israel as supposedly democratic state, or supposedly respecting to an extent some international law, there was this opposition among some of Israel's hardcore supporters to annexation, because of the worry that this might generate unwanted attention and unwanted accusation of apartheid against Israel. Finally, and thirdly, it's very important, after we have talked about the delay of annexation, not to forget about it, because it's very disturbing that many people have just moved along. Israel, as it has done in Jerusalem and it has done elsewhere in Palestine, Israel has accustomed us to implementing many of its steps in installments. So rather than immediately or in one step implement violations against Palestinians, Israel has been doing it in installments. And one example of this is, for instance, the annexation of the de facto annexation that has been taking place over the decades in the West Bank. It didn't happen in one day or one night. It has been a process that has been happening for a long time. Again, land confiscation, for instance, it has been a process. It didn't happen with just one decision that Israel decided to annex all of Palestinian land. Israel is very smart in the way it has been annexing Palestinian territory. It has been displacing Palestinians. Obviously, there were these watershed moments like the Nakba in 1948 and like the war in 1967. But since 1967, Israel has accustomed us to this annexation and dispossession by installments. And this is precisely why, despite the delay in implementing formal annexation, we shouldn't hurry to celebrate this delay as some sort of triumph, and we should be very concerned on how Israel is planning to escalate this and to take advantage of the world turning the other eye in order to implement it. Finally, I will just end on one personal note on how this whole pandemic has been affecting Palestinian people. Obviously, Asil talked about her own experience living in Kufr Aqab. And I just want to give an example of a colleague who is based in Jerusalem and who has tested positive for corona and who had to self-quarantine in her home because of Israel's prohibition on Palestinians to build or to expand, and because of Israel's requirement for building permits that it denies to Palestinians. Palestinian families in Jerusalem are forced to be crammed in small houses. So this colleague of mine is self-quarantined in her home with her 4 children and with her partner in a 50 square meter home, lacking the most basic accommodations. But because she has no option but to stay in Jerusalem, precisely because she fears risking losing her residence, because if she stays away from Jerusalem, she will lose her residency. And this is precisely why she insisted on staying. But what she is paying as a price is that she has not been able to even take, her children can't even go outside home. They can't even have anything resembling adequate housing. So this is precisely when we say that Corona meets the occupation or the systematic injustice created by the occupation. This is what we mean. She doesn't obviously have the luxury of a garden. And we know that this is a reality that faces millions of people around the world, or tens of millions of people around the world, due to structural poverty, due to capitalism, obviously. But this reality of capitalism, neoliberal development, and Israel's occupation really has entrenched and has a particularly crude outline in Jerusalem, particularly since March. And this is where Rania's recommendations that she mentioned are particularly important, because all the time we Palestinians say, and not just Palestinians, everyone says that the situation can't go back to what it was, because it was never normal. The situation before the COVID crisis was never normal, not just in Palestine, but everywhere. But this form of state of exception that Palestinians have been forced to normalize for decades has never resembled normalcy. And this is particularly why when we say that we can't go back to what life was before, that the normalcy that many people want to restore is wrong and should not be restored, because it was always discriminatory, it was always racist, and it was never normal for the millions of people who have to undergo it. This is particularly so in the case of Jerusalem in particular, and in the case of Palestinians in general.
Thank you so much for that, Badur. And I don't think I've ever heard you speak on a panel where I haven't been sort of really energized by what it is that you have to say. And there's plenty to reflect on there, of course, including, I mean, really importantly, the danger of allowing our attention to flip from issue to issue here and to fail to see the big picture, in particular the importance of highlighting the links between what is happening to Palestinians in East Jerusalem, in the rest of the West Bank, in Gaza, and elsewhere. We don't want to sort of isolate the issues in the way that Palestinians have been isolated from each other, for example, by the wall. And also a really important reminder of the importance of meaningful consequences for serious violations of international law. Badur, your camera's got knocked, so we've got your shoulder. So if you could adjust that, that'd be great. In the meantime, we're going to turn to questions and answers now. And I see that quite a few of them have come in. And I see also that Rania is getting involved in some of them in the chat as well. Maybe a straightforward one to start with. I mean, I say it's straightforward, but I guess none of the panelists will find it particularly easy to answer. A question from Diane who asked quite simply, what realistically can we do as individuals? So if any of the panelists would like to think, I mean, we have a really sort of diverse array of people in the audience here. Some of them might be policymakers, some of them might be private individuals, but on an individual level, we look at some of these issues and we see how serious they are. Have you got any thoughts on what individuals around the world should be doing, thinking and saying in response to some of these issues?
Rania, go ahead, perhaps.
Oh, you're muted, Rania.
Sorry, I'm muted. Could you just say that again?
Sure. The question was from Diane. What realistically can we do as individuals in response to some of these issues?
Absolutely. I think that's a very important question. Of course, I've already outlined the recommendations in the briefing paper, which were mostly for states. What individuals do, one of the things I've written down also in the comments is that I think it's important to try to understand the bigger picture and to understand that when it comes to the right to health in Palestine and other individual rights of Palestinians, they cannot be fully realized so long as the root causes aren't addressed. And so for us, I think that that's one of the biggest and most important recommendations, is to address these root causes which continue to entrench Palestinian oppression. And for Jerusalem, obviously, that means reversing the annexation, the legal annexation, as well as in general, realizing Palestinian rights to self-determination in return. Individuals can play a very important role, whether it's civil society, global civil society, to call on their own governments to abide by their own responsibilities, not to further contribute to entrenching this reality, not to recognize it as legal, not to contribute to its maintenance, including through economic measures. I referred briefly to the recent report by the UN Special Rapporteur, Michael Link, on collective punishment. One of his main recommendations for states was to adopt effective measures such as countermeasures and sanctions to reverse the illegal occupation and bring the occupation to an end. So these are really our demands at the moment, and it is something that we should be focusing on. Another important avenue that should receive widespread support by individuals and civil society is the question of international justice and accountability. For us, this is a really important point in relation to ending Israeli impunity. And the most direct avenue for this right now is the International Criminal Court. The International Criminal Court prosecutor has already said that war crimes are being or have been committed in the occupied West Bank and Gaza Strip, and that these obviously need to be remedied and held to account. For us, this is a very important demand by Palestinian civil society, Al-Haq, and many partner organizations working on the question of the ICC. We think that the ICC is a very important avenue for justice for Palestinians, and that it will send a very straight and direct message that impunity will no longer be tolerated.
Thank you, Rania. Badur or Asil, have you got any additional thoughts on what individuals can realistically be doing in response to some of these issues?
I mean, this is one of the really difficult questions that we always get, is what we can do to change the situation. And I think, I mean, all of us are a little bit despairing recently because we see that things, it's not that things were perfect at any point, obviously, but that there is this total collapse of even the pretense of multilateralism, even the pretense of the international community trying to even uphold a certain rights-based discourse, that even the discourse or the pretense of this discourse doesn't even exist anymore, especially when we talk about leading governments going outright populist, not to use a different term, and not to hurt sensitivities. But I guess this is definitely concerning, but I definitely agree with what Rania said regarding recommendations, especially the avenue of the ICC, especially the avenue of also putting pressure. The thing is, for such a long time, Israel has found that whatever policies it commits against Palestinians, whatever violations, unless it goes really wild, that it doesn't have to pay any price. And the challenge that faces us all is, are we willing to make this reality continue or not? Is Israel going to commit all of its violations against the Palestinian people without ever paying any price? Because let's face it, I mean, for the regular Israeli settler or citizen or whatever you want to call him, there's no point in even opposing Israeli policies against Palestinians because they don't feel pressure to do so, because they have their privileges intact. And this is the challenge, is these privileges shouldn't stay. This privilege that Israel as a Jewish democratic state, as mainly as a Jewish state for the Jewish people, affords all Israelis, these privileges shouldn't stay intact. And this is the really challenge that faces us, is, are we willing to keep perpetuate maintain a situation wherein these privileges are intact, or are we willing to force Israel to pay a price for its violations of Palestinians? And paying price, and Rania just gave examples of how we can put pressure on Israel to pay price for its violations of Palestinian rights.
Fantastic, thank you so much, Badur. And Asil, any thoughts from you?
Yeah, thank you, Badur and Rania. I always believe that each individual can do something with the surrounding they live in. For example, as a resident of the UK, you can email your MP for an action or for a question. You can also support MAP or all organizations that work towards the Palestinian cause, and all the organizations that have programs in East Jerusalem. I think our mission is to try to change the discourse and the narrative, and to make the story and the truth clear. So I think each one can do something in the surrounding they live in.
Fantastic, thank you so much, Asil. Another question, we have well, two questions here from Vincent Feen, who is a MAP trustee, as well as his own individual. He asked two questions. Firstly, has the EU taken up funding of the 6 East Jerusalem hospitals? Several of you have mentioned those hospitals after the US administration cut its funding. And also whether any of the panelists can talk about the impact on hospitals of the sort of cessation of cooperation between the PA and Israel. How are Palestinians getting access at the moment to those hospitals in the West Bank? Rania, I know that you've sort of looked into access issues recently. Can you give us Al-Haq's perspective?
Absolutely. I think this is a very key question. Just last month, on the 26th of June, we submitted together with a few partner organizations, including PCHR and Al-Mizan in Gaza, as well as the Cairo Institute for Human Rights Studies, a joint urgent appeal to the UN special procedures on this question, where we highlighted the really dire conditions of Palestinian patients at the moment and their difficulty in accessing healthcare. We focused on Palestinian patients in the Gaza Strip because at the moment they have no means of accessing treatment in Jerusalem in most cases. And therefore we also highlighted the cases of 2 Palestinian infants who died after being denied access to East Jerusalem hospitals in Gaza. So this is really the situation that we're talking about right now, and one of the main points that we highlighted in this appeal, and I think it's available, we can just send it in the chat box, is that preconditioning access to healthcare through Israel's permit regime and closure regime, which in particular impacts Palestinians in Gaza, is in and of itself arbitrary and illegal, because it means that Palestinians are denied access to the treatment that they need. And this obviously creates a barrier for them to access treatment. So for us, the really important focus here should be on the question of the closure. The Gaza closure for many years has been deemed illegal as a form of collective punishment. And most recently, the UN Special Rapporteur on Palestine called on all forms for Israel to end all forms of collective punishment, including the Gaza closure. And this, by the way, was also one of the main recommendations of the UN Commission of Inquiry last year, saying that the Gaza blockade needs to be ended with immediate effect. So I think that we need to really start looking at these root causes that undermine Palestinian access to healthcare, rather than looking for for short-term and medium solutions that don't address the root of the problem. And I think we'd be happy to send the link to that and of course answer more questions on this.
Thank you so much. And also just on the question of EU funding to hospitals, Vincent, I know that the EU did provide, I think they've now provided 2 years in a row, roughly, I think the last year, when I'm looking up the figures now, is 70 million euros to that hospital network. Of course, I want to sort of bring it back to the point that Rania made in her remarks earlier about the right of Palestinians to develop their own healthcare, and ultimately there are many barriers to the sort of the sustainability of those hospitals and healthcare in East Jerusalem and the Palestinian presence of healthcare in those areas. And really, it's important, the contributions at the moment, especially in the times of a crisis such as the pandemic, are really important. But we do also need to hopefully make sure that in future that money doesn't need to be spent. We've got about 5 minutes left, which isn't a huge amount of time. So maybe if I rattle through one more question, and there are quite a few here. Maybe this one, how is the general health of the population bearing up? The economy was weak before COVID-19, and with the lockdown, I hear, for example, that many people have not received their salaries for several months. How are people surviving? So there's a question there to sort of broaden out in that complicated but important interrelation between economic factors and health. Would any of the panelists care to answer that question?
Yeah, I can talk about that. So the situation in Jerusalem is, to say that it's quite dire economically is an understatement, really. Obviously, it was that way before the pandemic. And it's not just, it's again the result of a combination of factors, including Israel's occupation, including the closures, including, especially for Palestinian Jerusalem, the closures, for instance, happened, the highest point of the closure, the initial closure, was during both the Easter holidays in April and immediately the Ramadan month. And these for Palestinians, especially for Palestinian vendors, for Palestinians who have businesses in Jerusalem, these are the periods in the year that they desperately wait for, because these are the periods when tourists come. These are the periods when people come also from around Palestine to Jerusalem to pray, to buy stuff, to shop. And they have, basically this period didn't exist for them because of the closure. So that was the hardest knock. And then immediately after that, or just shortly after that, after the reopening, we've been going through the second wave. And even Israeli middle class Israeli citizens, we're seeing them protesting, because they're protesting the mishandling of their government of the crisis, and they're protesting their own dire situation that has worsened during the pandemic. So just even imagine if Israeli middle class citizens are protesting, imagine what it's like for Palestinians for whom decades of occupation, de-development, denial of rights, denial of freedom of movement have exacerbated their poverty, have condemned them to poverty and to discrimination. So imagine what this period is like for them. Obviously, many even ask for, do Palestinians join the protest? Palestinians don't, simply for two reasons. Simply because these protests are not really geared toward more justice, but rather for justice for a small portion of the society, which is the Israeli society, rather than for everyone. And secondly, because if Palestinians even think about taking to the streets, we know the police brutality and the occupation and the military response that is going to be awaiting them if they take to the streets. All Palestinians everywhere in the West Bank, in Gaza, in Jerusalem, and in the 48 territories have been influenced by the pandemic, so just like everyone worldwide. But the combination of occupation and also the fear that when Israel decides to whom to grant rights, to whom to grant benefits, that again Palestinian will be discriminated against. This is another factor. And especially for Palestinians, for example, talking about Palestinian street vendors or freelance workers, or people who never had any sort of protection before, who even before the pandemic were systematically kicked off the streets by Israeli inspectors, and now they don't even have this vulnerable, precarious jobs that they used to have before the pandemic. Even this precarity there, it seems like a luxury right now. So yeah, the situation is really dire, and it's one thing that really scares us, that this difficult economic situation, and the fact that Palestinians still have to pay taxes, Arnona taxes, and all sorts of taxes to the Israeli occupation municipality, that these factors will combine to push Palestinians out of the city and to add another factor to the forced dispossession and displacement that Palestinians have been facing for many decades. So this is why we always say that any solution or any vision that we have to envision for life after corona, it has to be inclusive. It has to include all those elements: social, political, economic, but mainly it has to start with the political, because all that Palestinians have been going through, the root causes for this is the occupation, annexation, and Israeli colonialism and apartheid.
Well, that takes us exactly to the hour, so I'm going to end it there. But I just want to say a really sincere thank you to Rania, Badur, and Asil for really an excellent and informative panel. I mean, each contribution was really excellent. I really hope that all of you in the audience will go and read the briefing paper. There's plenty more in there. It's available at map.org.uk/EJ-COVID. And I also hope that you'll check out each of the organisations and their work. As I mentioned, MAP is currently in the process of an emergency response to the COVID-19 pandemic, and we've really had to, for the first time ever, respond to a crisis across all 3 areas of operation. And you can read more about that at map.org.uk. And also go and check out the really important work, advocacy, research, and everything that Al-Haq are doing at alhaq.org, and of course that JLAC are doing at jlac.ps. So thank you again to all of you for joining us. Thank you very much to our panel, and a special thank you behind the scenes to Rasheen Jacqueline, who has been a real stalwart and has put all of this together and made all of this possible. So thank you very much, and we hope to see you again soon. Take care.